If you're a dentist and you're trying to decide if you should buy a practice or start a practice, then you should watch this video. So let's talk about this. So this is probably the most common question I get from doctors, whether or not they should buy a practice or start one from scratch. And it really comes down to a couple of things. One is definitely your level of debt. If you have high debt from school debt or personal debt or whatever that it is, then you probably need a high cash flow. And then you really can't start a practice from scratch because usually that takes a little while to get going. So, and you're not going to have the cash flow. So a lot of times in those cases, it makes more sense to buy an established practice. And don't just buy any established practice, you buy an established practice that has a good cash flow. So it really comes down to two categories when you're buying established practices. One is with a good cash flow and one is like a fixer-upper. We've done a fixer-upper and it worked out for us, but it doesn't always work out well because it doesn't have very good cash flow. So if you buy a fixer-upper established practice, for example, it's doing $400,000 a year, and you hope to grow it. The problem with that is it's kind of like a startup with just a little bit of a cash flow, and hopefully you can grow it and hopefully it will take off and it's not the practice that's sinking. So it's very important to look at the practice, make sure there's a lot of dentistry to be done in that practice still, and it's not like it's a dying practice where most of the patients already left and what you see is just the leftover. So it's very important to look at that. Or there are established practices that are doing well, that may be doing over $1 million a year, $1 million plus in collections, and those practices will have a better cash flow that you will be able to service your debt. So when you're looking at established practices, you want to make sure you're looking at, is it a fixer-upper, is it an established practice, is it growing? And then you also have to really make sure it's not like a niche practice where, for example, the selling doctor is, I just use an example, the selling doctor is Hungarian or whatever ethnicity it might be, and then they're leaving, and then 80% of the patients are from that ethnic group that are going to leave with the doctor or go somewhere else. So you have to kind of look at that and make sure that the practice has a good wide range of patient base. So those are things to consider. Now, if you do a startup, please make sure that it's in a viable area. So you want to make sure that the patients in the area have dental need, and also that you're able to provide those services that those patients want. And also look at the level of competition. So what I see all the time is doctors setting up these practices in an area that's super saturated with other doctors, and patients don't really have a dental need. So what am I talking about? They're like high middle class suburban cities where there are 1,000 doctors and patients don't need any dentistry because they take good care of their teeth. You're not going to do very well in those areas. And I hate to tell you, and I see this all the time, I see a lot of struggling doctors in those areas. Before you set up a practice, you got to make sure that you're not in the area where patients have very limited dental need and there's a lot of competition. My dog loves to dig holes in our yard. Bernie, what are you doing? So that's the topic on buying a practice, an established practice. Now, if you do a startup, then the startups that I see that do well are either niche practices where you specialize in something, quote unquote, specialize as a GP, like you do a lot of orthodontics, like comprehensive orthodontics, you do a lot of sleep apnea, you do a lot of TMD, or a lot of surgery, especially. Those practices tend to do well, even in more saturated areas. But that's very few doctors. That's like 2% of the doctors. And then doctors who do really well with startups are the one that go in underserved area. It does not have to be rural. Underserved area could be in a city too. For example, especially blue collar areas in cities that are just a little bit outside of the downtown, and they tend to be a little bit more blue collar and they tend to be a little bit more underserved. Those practices do really well. Or practices that are in more rural areas, and I'm talking about like pretty rural, maybe about an hour from the city, the closest large city, and also pretty blue collar or middle class, low middle class. Those practices do really, really well because they have the perfect combination of high dental need. Patients have high dental need, and there are a lot less providers. So when you're starting up, I would really consider those things. And please be super careful starting a new practice in a city where it's high middle class or higher, where patients have very little dental need, and there are a lot of providers. I see a lot of struggling practices in those areas. So I would consider this probably my favorite. If you ask me what I recommend, I think I would look for an established practice that's doing at least $1 million with good cash flow and good overhead, that has a good wide patient base. I mean, it's not like a certain one type of group, but it's like a good variety of patients with different backgrounds, and a good team that's already there. So I would look for a practice like that. Or if you really have to do a startup, I want to make sure that you don't need a high cash flow, or you're going to have to get a job and work in that job while you grow it. And if you do a startup, I think the best would be if you go back to the town where you're from, that's kind of like an underserved area, probably heavy blue collar, about an hour from the city, and a lot of dental need and a lot less providers. Or if you have a niche practice, then double down on your niche, which could be orthodontics, comprehensive orthodontics as a GP, surgery as a GP, TMD treatment, sleep, whatever that might be, and really double down on growing that. So hopefully this helps you and answers some of your questions, okay? If you have any questions, feel free to post it below this video.